Hi, my name is Yvonne Rodriguez, and before I started Injury to Victory, I was dealing with pain mostly in my knees, my hips, and my lower back. The pain that I was dealing with was very limiting for me. For someone that likes to work out a lot, I got to a point that I just kind of hit a wall and I was having difficulty increasing weights. I started having problems going up and down the stairs because my knees were hurt a lot. I was constantly having back pain, and it was getting to the point that it was harder to work out to keep myself in shape than it was to deal with the pain. Where I happen to work at is a school. My school does not have any elevators. So constantly throughout the day, I'm going up and down the stairs to retrieve items, to retrieve kids, to help out other staff members. And it just started slowing me down to the point that if I had to go upstairs, I was kind of dreading going up the stairs because eventually I have to come down and that would hurt too. When I went to the gym, one of my favorite machines is the leg press. And it got to the point that when I was on the leg press, I was constantly having to put on these very heavy duty knee braces just to get through doing my reps. And to me, that was a problem because I shouldn't have to wear knee braces in the first place. So far, working with Injury to Victory has been perfect for me. I like the at-home workouts. I like the ability to go to the gym and actually still get to use some of my weights that I like to use. But the best part is the fact that I do have more mobility in my hips now. Like one of the exercises was, I think it was the 90-90s. And when I first started out, I was probably about maybe 6 to 8 inches off the ground, and I could not get my knees to touch it at all. And about 2 weeks later, I finally hit the ground. And the first thing I did was look to make sure I was doing it right, and then realized I was doing it right. It finally got better. So I'm like, okay, I love this. This works for me. It's definitely something I would want to continue doing because if I have this much progress so far in 6 weeks, another 6 weeks later, I'll probably be running. And that's one of my biggest goals is to get back to running because I love doing it. Right now, my ability to go up and down the stairs, even inclines and hills, has improved since I started. Recently, we took the kids at the school on a camping trip. There were a lot of hills, inclines, and I was actually able to get up and down the hills a lot faster than anyone else. And at the end of it, I wasn't even sore. For me, that was the biggest flex. My knees did not hurt after I went up and down this hill for 20 miles. I was perfectly fine. Right now, part of the program was a series of different types of squats, right? And my squats now are 10 times better than they were before because I was unstable, I was falling, or I would stumble, or I would have to kind of stop at a certain point. And I mean, it was like maybe 10 reps, and I'd have to stop and maybe take a break for like 5 or 10 minutes before I can go back and do it again because my knees were sore or my back was hurting. Or I was getting fed up with the fact that I kept trying to do these squats the proper way and I kept tilting forward, or I was kind of jarring back when I stood up again. The other things I tried to alleviate the pain and get to the bottom of why I was having the pain was going to my physical therapist at the VA, going to my general physician at the VA, seeking out acupuncture, trying to find routines on YouTube and Instagram. And then finally, I found a video and I watched the trainer in the video and I thought, okay, that's where I'm trying to get to. And I reached out and now I'm here. Some of the things that kind of, I'll say, made me hesitate as far as reaching out to Injury to Victory was, what if it's a scam? What if the trainer doesn't show up? Or what if they give me something I can't do? And then when I tell them, hey, I have a problem, they're not willing to work with me. And I didn't have that problem here. One of the biggest differences with this approach versus what I was dealing with at the VA is the VA just kind of kept trying to medicate and hide the symptom instead of addressing the problem that was causing the symptoms. And with this, I was able to look at my diet and see how my diet influenced how I was feeling, how it influenced the inflammation I was having, or, whether I was having stomach pain, if my joints were hurting. And once I started changing my diet, I noticed a difference in how I felt. And I did drop a little bit of weight, but it wasn't negative weight. I was basically just dropping the stuff I didn't need and building on muscle mass. So I stayed the same size as far as my clothing size, but I probably dropped about 10 pounds. So the best part so far has been a lot of it is the education, learning behind, what's going on in the background and how it really affects what's going on with what I see and how I feel. Learning some better ways to eat because for the most part, I thought, oh, okay, I eat pretty healthy, but then I didn't realize how many processed things I was eating and how to cut some of those things out of my diet and how it made a difference. Another part was learning some new methods and techniques that I can incorporate into my workouts and things that I can do where I don't even necessarily have to be in the gym. I can do them at home, or if I'm at work and maybe I'm a little stiff, I can, sit on the floor and just kind of stretch out my hips real quick and move on with the rest of my day. This is something I would definitely recommend to someone who is dealing with knee pain, back pain, joint pain in particular, because at this point I'm convinced that if I told my trainer that my wrist hurt, they would have 15 exercises for me to do to work on the mobility so that it would actually work better and feel better. Just the fact that I was able to go to not one, but 6 separate events and wear heels, and my knees didn't hurt, my back didn't hurt. That's a vast improvement as to where I was in January. And by January, I was already fed up with the knee pain. The best advice I can give you is that if you're in pain, you don't want to have surgery, and in my case, again, and you're looking for a holistic way to relieve the pain, this is something worth trying, because I definitely don't regret it at all.